is it a concern that Delhi, despite the numbers on paper looking worse than Chennai, is not enforcing a lockdown? Well, let's ask Atishi of the Aam Aadmi Party. Thank you for joining us tonight. Atishi, there are no plans for another lockdown in Delhi. The Chief Minister tweeted today rejecting speculation spurred by the spike in coronavirus cases in the capital. But Atishi, Delhi has more than 41,000 cases, over 1,300 deaths, complaints about a severe shortage of hospital beds. So why such a clear ruling out of a lockdown?
Sarah, I think that what we need to understand is when we are looking at the coronavirus, the pandemic, is that this is a crisis of the scale that the world has never seen before. I mean, this is a highly infectious disease, a disease which has no cure. So obviously this puts all countries, all cities, all areas, especially densely populated areas, into a serious crisis. Now, the problem, however, is that there has been a lockdown of 2 months across the entire country, and including Delhi as well. And despite the lockdown, the number of cases continued to increase. Now, there is a situation of, there's a saying in Hindi called Aage kuan piche khai, that if on the one hand you have a serious health and medical crisis caused by the coronavirus, on the other hand you have a serious economic crisis that is caused by the lockdown, that the kind of deprivation that one has seen with migrants, them walking across almost thousands of kilometers because of the shutdown of the economy, is also a very serious concern. There's another very serious level of concerns that when you have a total lockdown, in Delhi you had, because we collect a lot of medical data, you have patients. So now you have cancer patients who cannot get chemotherapy during the lockdown. You have HIV positive patients who cannot get the antiretrovirals. The number of institutional deliveries in hospitals came by 15-20%.
They are not getting because there's complete shortage of beds. So Atishi, you made that point about the economy.
No, Sarah, I would like to correct you that there is no shortage of beds in Delhi. There was a phase for a few days in between when several private hospitals completed their quota of beds, but beds are available in government hospitals, more than 2,500 beds, and for private hospitals, we are linking hotels with private hospitals for anyone who wants to go there.
All right, Atishi, I hope you'll stay on after the interview, because we do also have a reality check on the number of beds available in 5 of the major leading hospitals. We'll have a report coming up. But let me ask you, you pointed out that, the economy has to be taken into consideration, right? The Chief Minister is aware that there are calls on social media to relock Delhi. He mentioned that. You're aware of the public's fears. Last week, shop traders voiced concerns about opening up for their own safety and that of the customers, right? You're saying the lockdown is being lifted because the economy is doing badly. Should we believe that it is safe to go out? Is the government not responsible for many in Delhi who are saying, okay, I can go out and get a haircut because the government is saying it's okay?
No, I know the government is very clearly saying that 3 things need to be done at all points of time. Number 1, social distancing. Number 2, wearing of masks. Number 3, washing of hands. And I think these 3 things remain absolutely essential if the spread of the disease has to be stopped. But I think what one needs to understand is another thing, Sarah, that if the economy goes into a spiral, tomorrow the government will not be able to afford to pay salaries of the doctors, salaries of any officials, to take care of the entire healthcare system, because finally the government is running on taxes that comes from a moving economy. And so if you shut down, if you have another full lockdown, then tomorrow, what are you going to do if the government can no longer afford to pay the salaries of doctors?
Okay, sure, you're caught between a rock and a hard place. But in Tamil Nadu, for example, the Chief Minister's decision has come on the advice of experts, medical experts, senior epidemiologists. They've had a 19-member expert committee saying that you should cut down on relaxations, maybe on the weekend. It will prevent the spread of the virus. We have, 220 hotspots or containment zones in the capital. Many are concerned. Many, for example, in my colony, they are saying we should lock down. Even if the government doesn't, the colony should lock down because we're worried we are not going to be safe.
No, I think absolutely. I think that the fact of the matter is that citizens have to be careful. And I think that what we need to realize is that the coronavirus is not going away anytime soon. And so therefore, making masks and social distancing and regular washing of hands, or sanitization, of reducing the amount of public interaction we have, is something that needs to become a part of our lives. There is no other choice.
Okay, so Atishi, one last quick question. You know, today we've had this flurry of meetings between the Chief Minister, the Home Minister, and a lot of reassurance for the public, because both the centre and the state are now saying we're going to see more testing in the capital and at a lower cost. Can you explain to me how suddenly overnight this is going to happen? Because until last week, the Aam Aadmi Party was at loggerheads with the centre, saying, you're telling us we're not doing enough tests. In order to do more tests, you have to change the ICMR guidelines. ICMR guidelines haven't changed. So how will suddenly tomorrow testing become easier for the residents of the national capital?
So I think that, yes, of course, the central government has also wanted that the number of tests should increase. So we are assuming that ICMR will relax the guidelines, because the current capacity, the current limit on testing is really placed by some of those guidelines.
All samples must be taken in accordance to the ICMR guidelines. That is, the instructions given by the Aam Aadmi Party today, when the Chief Minister said all labs will work at full capacity, private labs must give results in 24 to 48 hours. How? If everybody who wants to get a test can go in and get a test, will they be able to deliver that?
No, so the thing is that, yes, Delhi has, as it is, been testing far more than all other states. I think that Delhi is testing double the amount per million. I think Rajasthan and Tamil Nadu are probably at number 2 at about 6,500 tests per million. Delhi even now stands at 13,000 tests per million, the greatest number of tests that any state is conducting across the country. We have been in the process of increasing capacity, both of government labs and private labs. But of course, as you can understand, it is not as if the testing capacity can be doubled overnight.
All right. Thank you, Atishi. Of course, we must remind our viewers,
is a complex
Maharashtra,
procedure.
Delhi, all of them showing huge cases, also because they are doing more testing than other states. Thank you, Atishi. Do stay to watch that report, that reality check that we did in Delhi's hospitals.